So let's discuss acute abdomen today. The term acute abdomen refers to the signs and symptoms of abdominal pain and tenderness. This situation often represents an underlying surgical problem that requires prompt diagnosis and surgical treatment. While the ready availability of diagnostic studies such as CT or MRI has added greatly to our ability to accurately diagnose most of the conditions responsible for the acute abdomen, mainstay for diagnosis remains a good history and physical examination complemented by laboratory and radiologic studies as appropriate. In addition, many conditions that are not surgical or even centered in the abdomen can also cause this presentation. Prompt and accurate diagnosis is necessary in order to select the appropriate therapy, which may be a laparoscopy or a laparotomy. Age, gender, and a history of prior abdominal surgical procedures are associated with different problems causing the acute abdomen. Certain diseases like appendicitis and mesenteric adenitis are more common in the young, while biliary tract disease, diverticulitis, and intestinal ischemia are more common in the older population. Numerous problems that are not surgical may also present as an acute abdomen. These include endocrine and metabolic issues, hematologic problems, and disorders caused by toxins or drugs. Endocrine and metabolic diagnoses include uremia, diabetic or Addisonian crisis, acute intermittent porphyria, hyperlipoproteinemia, and hereditary Mediterranean fever. Hematologic disorders include sickle cell crisis and acute leukemia. Toxins and drugs that can cause acute abdominal pain are lead and other heavy metal intoxications, narcotic withdrawal, and black widow spider bites. All of these need to be considered when evaluating a patient with sudden onset of abdominal pain. The need for prompt surgical treatment of those causes of acute abdomen that requires operation mandates an expeditious evaluation so that the proper therapy can be carried out. A focused history and physical examination and indicated laboratory and imaging studies will then allow for the correct diagnosis and guide appropriate therapy, while imaging studies have added greatly to the accuracy of the diagnosis of causes of the acute abdomen. A thorough history and careful physical examination remains the mainstays of evaluation. So these are the various causes of acute abdomen, the non-surgical and surgical, given in these two boxes. The non-surgical causes we have already discussed in the paragraph. We'll be focusing on surgical causes of acute abdomen. Here the first one is the hemorrhage, which includes aortoduodenal fistula after aortic vascular graft, arteriovenous malformation of the GI tract, bleeding GI diverticulum, hemorrhagic pancreatitis, intestinal ulceration, leaking or ruptured arterial aneurysm, Mallory-Weiss syndrome, ruptured ectopic pregnancy, solid organ trauma, spontaneous splenic rupture. Regarding the infection, it can be appendicitis, cholecystitis, diverticulitis, hepatic abscess, Meckel diverticulitis, and psoas abscess. The ischemia includes Berger disease, ischemic colitis, mesenteric thrombosis or embolism, ovarian torsion, strangulated hernia, testicular torsion. There can also be obstruction, which includes sickle volvulus, gastrointestinal malignancy, incarcerated hernias, inflammatory bowel disease, intussusception, sigmoid volvulus, and small bowel obstruction. The patient may also present with perforation, which includes Boer-Haave syndrome, perforated diverticulum, perforated gastrointestinal cancer, and perforated gastrointestinal ulcer.